on providing an excellent patient experience. So this is the second webinar in a three-part series. And the webinar today is being recorded and will be posted to our website. And the first session, of course, in this series and the third session will also be on our website. So just in case if you missed the first session or if you'll happen to miss the third session, don't worry. Everything will be sent out to the participants and everybody who was invited to participate, both the slides and the recordings, and that'll be available on our website. So again, welcome. I'm Kate Stenyam, and I'm a program manager with the Delta Region Community Health Systems Development Program, which is providing this webinar today. So the Delta program is funded by the Federal Office of Rural Health Policy and in collaboration with the Delta Regional Authority. Next slide, please. Thank you. So before we get started on today's webinar, I just want to put in a plug for some more upcoming webinars. Like I mentioned before, next Thursday, April 22nd, that will be the third and final webinar in this series. And then on May 6th, we will have a webinar on value-based care options for rural. And the speaker on that webinar will be Dr. Clint McKinney. May 13th, financial risk and value-based care models. And that will be with Zach at BKD. Many of you have met Zach before. May 20th, optimizing ambulatory healthcare for the 21st century, and that is with Dr. John Burrows. May 27th is the successful models to engage providers in value-based care, and that is with Eric Schell of Stroudwater, who many of you have met as well. And then on June 3rd, the final session in that series will be best practices to work with community providers on population health initiatives. And that will be with Tony Ann Richards of the Healthcare Collaboration of Rural Missouri. Those are all posted on our website too, so you can find more information about each of those sessions on there. So as we move along today, in today's presentation, we really encourage, of course, questions and discussion. So either unmute your line or utilize that chat box. But we do ask if you're not speaking just to keep yourself on mute because that really helps cut down on feedback. Before we get started, if everybody could take just a brief minute, find the chat box and type in your name, your title, and your organization. That really helps our presenters get a good feel of the audience on the webinar today. So again, if you could find that chat box and just put in your name, your title, and your organization, that would be great. Next slide, please, Patricia. Thank you. We have a couple of pre-polling questions that we want you to answer before we get started on today's session. So Patricia, if you could please pull up the first pre-polling question. So please just take a couple seconds to fill this out. I am blank in my understanding of what it means to think of patients and families as customers. Are you confident, somewhat confident, neutral, somewhat unconfident, or unconfident? Patricia will give another about 5 or 10 seconds for you to fill that poll out. Thank you, Patricia. And we had 78% of respondents said confident, 19% somewhat confident, and 3% said somewhat unconfident. Okay, next we've just got one more. Can you pull up the second polling question?
Thank you.
So the second pre-polling question, I am blank in my understanding of techniques that improve patient and provider communications. Are you confident down to unconfident? And Patricia will give another 5 or 10 seconds for everybody to select their response on that one. And on that one, we had 30% are feeling confident, 57% somewhat confident, 11% neutral, and 3% somewhat unconfident. Great, thanks, Patricia. Next slide. So in this session today, participants are going to develop an increased awareness of what it means to think of your patients and their families as customers, and also thinking of fellow employees as customers. Carla will be really walking through to learn techniques to improve communication and listening skills. So now I would like to introduce today's presenter, Carla Wilbur. Carla is a senior consultant with Stroudwater Associates. She is a nurse administrator with a background in critical care, education, and emergency services. And she was previously the director of enterprise excellence at Wake Forest Baptist Health in Lexington Medical Center, where she facilitated lean transformation and was responsible for the development, implementation, and ongoing assessment of comprehensive performance improvement and lean redesign initiatives. So now I'm going to turn it over to Carla to get us started. Thanks, Carla.
Thanks, Kate. I appreciate it. Okay, next slide, please. This is part 2. A little bit about defining our customers, part of our objectives. Again, as Kate said, a little awareness around thinking of our patients and families as customers, our co-workers and other employees as customers, and then some communication and listening skills. Next slide. So thinking of our patients and families as customers. Next slide. I love this quote. Healthcare is hospitality with healing, a combination of 2 positives. And in my time of nursing, there has been a great deal of pushback to thinking of, our patients as customers, or that we have a hospitality type service. So I think that this really it shows that we can combine the 2, and it's a positive relationship. Next slide. So customer in the Latin means being accustomed to something or doing it repeatedly. But healthcare, the repetition and the trust that it builds are basis for loyalty between patients. I think it's really important.
I'm just going to jump in quick, Carla. Can everybody make sure they're muted? I'm getting some feedback, and it's hard to hear Carla. Everybody can mute their line, please.
Common ground to refer back to, like you said, that scripting or that agenda versus just like pulling it out of your brain.
Sorry for that, everybody. I think it's Vicki at Iron County. Can you mute your line, please?
One thing I'm getting at.
There we go.
There we go. Okay. Again, thinking of our customers and the trust that it builds within a healthcare relationship. I mean, that builds, the loyalty between patients and physicians. Next slide, please. So our patients, which are what we would call our external customers, are still consumers. Just because they're wearing a hospital gown doesn't mean that they're not choosing to use our service. And, the only problem with thinking of our patients as customers is if we let it be, or it causes delays in preventing change or improvements. Today, our patients are now a lot pretty computer savvy. When they can choose to use an organization, they're going to look at what's going on there and base their choice on what your scores are, what they hear. They're going to do some shopping. And so it's really important that we think about them as customers. It's based on expectations. Patients do judge healthcare, and some are a little more savvy than others, but they do judge healthcare. And one bad experience at our organization can really just completely move that patient to another healthcare organization or healthcare system. I love this. Healthcare is enforced hospitality, involuntary hospitality. Back in my day, I used to have staff members that would say, well, we're not the Hyatt, we're not a hotel, we don't serve them. They shouldn't expect to be served like that. But it used to be that historically that patients and families really cared more about that high quality clinical care. Happiness was secondary to that, but that's not really the case anymore. I think everyone has become more accustomed to the fact that we can have both, and we should have both. So it's not as much of a results versus that bedside manner. We expect both. Improved experiences are definitely associated with the quality of care. There have been a lot of research projects, one especially from groups kind of like Agency for Healthcare Research and Quality, that show that there are improved outcomes based on the experience, and so that they are definitely positively correlated. And when patients do take a little bit more control, when they're customers, they take a little bit more control and responsibility for that relationship. When we start changing that dynamic of the relationship with patients and providers and all caregivers, it really does put a little bit more emphasis on their control over their care plan and their ongoing improvement efforts, and their to whatever degree that's needed, whether it's a chronic disease management or if this is just an acute episode that will be resolved quickly. And then healthcare is moving from that provider-centric to a patient-centric environment. And that's very, very important for us to remember, because patients want more options to choose. There has been and still continues to be a great deal of conversation around telehealth. And if anyone has seen recently, Amazon's entry into telehealth and telehealth primary care. And that's pretty scary in our environments, because in rural America, if we lose some of our younger population that are a little bit more computer savvy and do want that immediate touch using telehealth with a primary care, then we are, taking out revenue out of our own organization. So we have to really think about how we drive, the patient-centric models for our organizations, and move it from, it's no longer just that what the provider wants, it's more about what that patient and family needs. And that should drive our improvements and changes within our organizations. Next slide, please. So I always use, as a lean trained person, my first sensei, which was my coach, always said every time that we're trying to make improvements, we need to understand our purpose. So what is our purpose? Learning to see the purpose through the lens of our patients. And also, are all of our employees in tune to what our purpose is and what we are, from orientation on, what our expectations are of them, and of, how we're going to care for our patients and family members. We need to always kind of change from closed-ended to open-ended questions so that we can understand and really individualize the care to the degree possible. Asking things that actually has a little bit more personal touch. That's very, very important. And as I spoke at the first session about the wow, we want wow from start to finish. From the minute that the patient or family member drives into our parking lots to the day that they leave, they should think this is a wonderful place from start to finish. Holistic interests and not just clinical interests. In medicine, holistic is characterized by maybe the treatment of the whole person, taking into account the mental, social factors, not just the symptoms of the disease. So that's very, very important. And patient-centric scheduling, what works well for them, sharing timely information. It's very, very anxiety-driven to expect to get a test result, and we don't produce that test result in a timely manner. So that too improves the patient experience. And one thing that I think is really important, there was a Journal of Patient Experience and the author Micah Solomon, the one from the quote earlier, said, everything we do gives off clues, whether that be wearing dirty shoes. He used the example of somebody that had lipstick on their teeth. You may not know that, but your patients will. It's making sure that we use great language. We don't use poor language. We don't avoid eye contact. And one thing he spoke about in that particular article was that, creating the wow from start to finish is, what if there are staff members that are not yet on duty, or staff members that just got off duty? They are still and should be still responsible for acting as though they are on duty. So we don't want our patients or family members to ever pick up on any cues that can impact their experience with us. Next slide, please. So patient involvement, or many know this as patient activation. So that has to do with the patient's knowledge, the patient's skills, their aptitude to do, and make change, and the willingness to make change as well. So, but engagement is kind of a combination of involvement / activation with interventions. So there are 9 factors of engagement. Active listening, really being present in the moment, non-multitasking. So that's one thing at a time, real focus. Sometimes we tend to use the bedside computer and kind of not have that contact. Oh, pardon me. It's allergy season. So maintaining that eye contact and staying present with them so that they know that we are listening. Having the right tone of voice. It's really important for our patients that we have a soft, kind, warm tone of voice and not be loud. Now, there are patients who really love that boisterous discussion. And if they do, you can figure that out. But really being concerned with and knowledgeable about what tone of voice that we're using until we are certain that, this is not impacting their engagement in their plan of care. Appropriate speed of speech. And by that, it's really important. And I saw this firsthand with my elderly parents who had been in the hospital on different occasions. And if someone comes in and they're talking really fast, which we can tend to do, especially when we're really, really in a hurry and have a lot of things to accomplish, they don't hear what you're saying. You need to slow down, especially with some of the elderly population or the patients that maybe English is not their first language. Appropriate use of touch. There are people who do not mind, having that pat on the shoulder. And then there are others that's uncomfortable to them. And touch is only used specifically for their healthcare needs and not to just kind of, pat them on the shoulder and say, how are you doing today? So we really have to mirror what our patient exhibit, how they exhibit that type of behavior. The use of humor and emotion, both. Some patients are not feeling like having a joke. And then there are others. Had it been my father, he would have welcomed nurses to come in and have jokes because that's something that he always did. So we really have to be in tune to what really works best for our patient. And I focus a great deal throughout patient experience training on sitting, positioning. It doesn't take us any longer to sit at the bedside and speak with our patient or teach or assess if we can than to stand. And it makes our patients feel like we're paying them a lot more attention and that we're more present in the moment with them. And then mirroring the energy of the patient. If the patient is in an upbeat mood, that's great. If they're not, then let's make sure that we're cognizant of that. All of these things help to engage our patients in their plan of care and their ongoing ability to help us with their plan of care, have ownership in their plan of care, and improve their chances for a successful outcome when they discharge from our facilities. Next slide, please. So awareness, thinking of other employees as customers. Next slide. So treating your coworkers, those are our internal customers, with respect builds trust. So in the 7 Habits of the Highly Effective People, Stephen Covey used a metaphor of the emotional bank. And this was actually the amount of trust that has been built up in a relationship. As we develop these interpersonal relationships, and that we are treating each other with respect, we build trust within, and we build that emotional bank with our coworkers. We should always view everyone as a team member. That builds a healthy community, and it takes a great deal of work from all of us to deliver an excellent patient experience. So everyone is a team member. I mentioned the interpersonal relationships. It's great to know some things about your coworkers where you can build a little bit more of a personal relationship. It helps to create that positive workplace. A service-oriented approach with coworkers supports your commitment to supporting their needs. So we asked the question, not that this happens, but it's something that I saw posed one time. What if we were paid not on our performance, but how we treated our coworkers? How would we be paid? It's really important that our coworkers are treated just like customers, their internal customers. And managing up, clinically, most of you may know what managing up is. It's a Studer principle. It's managing up from shift to shift. I'm going off shift now, and Susie will be your night nurse, and she is great, and she will take wonderful care of you. And I have explained to her everything about your case, and that you're getting ready to have a test in the morning. And so she's on top of all of that. Just like with providers, explain that, that the patient is going to receive a provider consultation. This is a great, this provider is excellent, has excellent credentials and so forth. And then with other departments, I see that you're going to be going to CT, and they have state-of-the-art equipment, and they are really top-notch over there. So clinically, that's how we manage up, and we should do that with our staff members as well. Never, ever forget, appreciation does go a long way. And making sure that we embrace differences of each other. I do not like to surround myself with people that are just like me. Who would want so many boring people like me? We all bring a lot of different things to the table, and it's important that we embrace our differences and our strengths and weaknesses, and that actually helps us form a much, much, much more cohesive team. Next slide. So as with patients, learn to see what is purpose. What do we have in common for our goal and our purpose? All employees should be on board from orientation forward. Follow your coworkers through an entire process. or have them follow you through entire process, or think of maybe some mystery shopping. We need to understand the other employees' experiences to help drive that improvement in their experience. We may not know that if we made one small change, it would have helped another department. So we all need to kind of walk in the shoes of each other, and asking our coworkers for feedback. You know, what works well, what doesn't work so well. I had a situation one time with our materials department, and one of the staff members did not load my supply, and it was a closet, the way that we needed it to be, because it made a lot of work, extra work for us. So I was not about just to say, you know, he's never going to do it right. We got together and walked through the whole process, and well, he had no idea. So it's just communicating, you know, what's working well and what doesn't work so well. And using AIDIT with your coworkers. AIDIT, as we know, the communication tool that from Studer is perfect to use with everyone when you're acknowledging, introducing, duration, explanation, and thank you. It can always be used not only with our external customers, but our internal customers as well. And always pitch in without being asked. Everybody should work together. We all wear a lot of hats in rural America, and we need each other's help to make it work. And I think that from what I've heard over the last little over a year now, through COVID, the hospitals and clinics have all realized just how much they count on each other and how much they have been able to help each other get through this, because it was something that we have never, ever experienced before. I already mentioned making it a standard process of managing up. Everybody likes to be acknowledged. So it's very important that we manage up with each other. Next slide. So Stephen Covey also says synergy is better than my way or your way, it's our way. And that's true. Back to everyone being individuals, but we all have our own strengths. And as we all work together, then we can, you know, make all of our experiences much better. Next slide. I think that Kate added a question slide, so we could take just a breather if somebody wanted to ask any questions before I move forward.
Yeah, I thought this would be a good little breather halfway through the presentation. And remember, you can use the chat box for questions, or you can unmute. If anybody has any pain points they want to share, you know, maybe things that Carla could help you with, or success stories too, anything that you could share that's gone well in this area in your facility.
Yeah, we always like to hear if hospitals have made changes and have found something that worked really well for them and their organization. You guys are all really innovative and come up with a lot of neat things, and it's just a huge value for you to be able to share that with others. Anything in the chat box?
Nothing in the chat box. But
right.
so we'll keep going forward, but please, if something comes up as we're going along, feel free to pop it in the chat box and we can go through it in the Q&A at the end too.
All right, great. Thank you. Next slide, please. So improving communication and listening skills. Next slide. So there are top 10 communication skills. Listening, of course, nonverbal communication, clarity and concision, friendliness, confidence, empathy, which we talked a great more about last time, open-mindedness, respect, feedback, and picking the right medium. These are supposedly, and I agree with most of them, top 10 communication skills. Next slide. So listening, both with our internal and external customers. When we are actively listening, we are present in the moment. We're demonstrating concern. We use affirmations such as that you understand how that must make them feel. Asking specific questions. If someone's sharing with you, and it's appropriate to ask a question, then it definitely drives home the point that you are concerned, and that you're listening to what they have to say. All of this helps you build a good rapport with your coworkers and with your patients and family members. Active listening is hugely important. So many times people are so busy in their mind that when a patient or family member or one of our internal customers would be sharing, that our minds are thinking about what we're going to say next or what we have to do next. And that can be really obvious in a conversation. So just be very, very mindful of that, and look with establish eye contact, and listen actively for clues for things that the patient or family member or your internal customer are sharing with you. Next slide. Nonverbal communication, body language. I'd mentioned to another group recently about the eye roll. I hate that. That's just so disrespectful. But body language is really, really important. We don't want a closed approach to our patients, family members, or our coworkers. Having a relaxed, open stance makes you more approachable. It's not like that you're being inconvenienced. It's really important that we are in tune to our body language, because everyone has a different, a different way of exhibiting what they're thinking, or how they feel about things. So just make sure that that's something that you're in tune to. I had mentioned eye contact, and that's really important. That definitely is something that is nonverbal, that really demonstrates that you're focused on the patient or family member or your coworker. Next slide, please. Clarity and concision. Sometimes we have a difficult time being clear around what we're trying to communicate. And that's true in the workplace with our coworkers and sometimes with our patients and family members. We do struggle with wanting to give our patient and family members a great deal of information, because we desperately need to give them a great deal of information about their discharge, education around their disease process, or what to look out for when they get home, who they're going to call if they have a problem, making sure that they have their follow-up appointment. I mean, we are really bombarding our patients and family members with a great deal of information. So we need to make it, of course, we need to give it, but we need to make it as concise and clear as possible. I have personally recently had, unfortunately, a couple of occasions where my husband had to be in the hospital, and I am a nurse. I do this every day, and the discharge instructions were horrible. They bounced all over the place. Now, I know what the discharge plan is, and I understand this information, but had it been someone other than me, had my husband had to look at that information without me, he wouldn't have known what it actually meant, because it wasn't clear and it wasn't concise. It was very, very too many words in all these different places, which really didn't lead to the one sentence that could have cleared it all up. So we have to be cognizant of that, both with verbal and written communication. Next slide. Friendliness. Friendliness goes a long way, and a smile can go a long way for you as well. That shows that you are caring, that you are motivated to help them, motivated to help your coworker if something happens. I don't know if any of you guys watch TV, watch New Amsterdam on TV, but the medical director there on New Amsterdam, his whole thing is, how can I help you? Always immediately motivated to be helpful and friendly. So it's very important that we remember these things. The interpersonal skills are important for you as coworkers, and that helps you to also improve your patient experience as well. Next slide. Confidence, being confident in your interactions. This is really important. You know, confidence is really important for your patients and family members, because if they feel like somebody's not confident in what they are communicating to them, they may begin to question whether or not that information is actually accurate. And then again, that sets us up for a possible bad outcome if they don't listen to what we're trying to help them, how that we're trying to help them improve their discharge plan or their transition to care. So it's important that we demonstrate confidence with our interactions, and that's true with our coworkers as well. And, you know, if you make a decision to help a coworker, always keep your promise. Of course, there are emergencies, but always keep your promise. Make sure that you follow through with what you say you're going to do. That helps build that confidence in that relationship again. And that's what's very, very important, is that we have that good ongoing relationship. Exuding confidence can be as simple as making eye contact or using a firm, friendly tone. Sometimes we do have to be firm when we have certain discussions. That never means that we're rude. We're clear, concise, but maybe firm in a certain situation. Next slide. When we talked about empathy, I shared with you the Cleveland Clinic's model for demonstrating empathy with SAVE, supporting, let's work together, acknowledging this has been hard on you, validate, most people would feel the way you do, and then emotion naming, you feel sad. That's very, very simple to remember, but it's also a great communication technique. Communication has a lot to do with empathy, especially in healthcare. Next. And open-mindedness. This is my favorite quote for open-mindedness. The mind is like a parachute. It doesn't work if it's not open. Back to understanding and respecting the differences of others. We are all different. Our patients and families are all different, and our coworkers are all different. And that's a good thing, because it takes all of us to do what we're doing within our organization. And it takes all of us to have a good, healthy community. So we do need to be open-minded. Next slide. Respect. It was said that respect begets respect. So if you give respect, you take respect. So if someone is rude to you, that doesn't mean that we're rude back. We treat everyone with respect because that's the right thing to do. And respect is a really, really key component of appropriate communication skills. Next slide. Thank you. And then feedback. So there are 3 different types of feedback, positive, of course, negative, and constructive. And so we should all be willing to give and receive feedback and be open to it. Sometimes we don't know something if someone doesn't share it with us. So it's important that we all accept that feedback and accept feedback from our patients and family members too. Next week, we'll talk about the Patient Family Advisory Council and how that's beneficial to a patient experience, And within that, that's part of receiving feedback from patients, family members about their experience in our organization. If we don't hear from them, we don't know. I've always given the example, my first patient family advisory council, I was absolutely shocked. The first thing I heard from a lady was that she was there at our organization. It was wintertime. She was there with her husband, and she didn't have a hanger in the closet to hang her coat. Well, I would have never known that, but that really upset her. So we put a process in place to make sure that we had hangers in the closets of the patient rooms in that situation. So feedback is very, very, very important, that we get feedback, and we'll talk more about that next week with our patient family advisory council. Next slide, please. So especially with your coworkers, picking the right medium. We saw that this is a very important communication technique. So not everything is is email. Not everything is phone. Some things we need to talk about in person. So picking the right medium when we're trying to communicate is highly important. If we have something to deliver to a coworker that may not be exceptionally nice or exceptionally pleasant, maybe it's an in-person conversation just to really first seek to understand before we go down a road that would not be quite good. So picking your medium when you're communicating, is it appropriate for it to be an email? Is it okay to pick up the phone, or is this something where you need to have an in-person communication? Next slide. So communication and health literacy. This is the vignette from the Joint Commission about a 68-year-old man who was discharged with heart failure and then subsequently readmitted. And that when they realized that he brought all his medicines back, they realized, well, his medicines had never been opened. Unfortunately, we missed the fact that this patient had never learned how to read, and that shouldn't happen. We should be very, very much in tune to health literacy. Where do we find our patients? And we need to meet them where they are. If they can read, that's great. If they can't read, we need to do something to help them be successful with managing their medications and their discharge plan. There has also been, and I have the quote here, that 40 to 80% of information provided by healthcare practitioners was forgotten immediately. That's really staggering, but not surprising, because patients and family members are not listening when they're ready to discharge. For one, they want to go home. So it's important that we do everything we can, regardless of where they are, to make sure that we communicate effectively and in their language. Next slide. And that may be by using what we call living room language. The AMA developed a few medical terms that they said, we should be really cognizant of. So in a medical term, just to take the top one, adverse, we may use, and we may all understand that. But for some patients, it would be better to use the word bad. Instead of an analgesic painkiller. I mean, there are so many different things that we really don't think about in our world because we're so used to using this language. But we should really try to focus on, as we're teaching and as we're communicating with patients and family members, that we use living room language as it's known. Next slide. So last week, I asked you the same thing, to think again of a place, and it's again. My place last week was Chick-fil-A, and how Chick-fil-A always across the country delivers consistent and pleasant service. We really need to give that a great thought. Where have we gone where we are treated with great customer service, and are we treated with great customer service within our organization? And are we treating each other with great customer service. Back to the question, what if you were paid not on your performance, but how you treated your coworkers? What would happen? So think about that place again, and what did it do? How did it wow you, and why? And then base that on what can we do to make these improvements in our own organization. Next slide. And next slide. All right.
Thank you so much, Carla. And again, if you have questions or comments, we've got the chat box, or please feel free to unmute your line. While you may be thinking of some questions or comments, including like thinking of what your place is that you think of that you've been to that has wowed you with service and that you could use as an example to bring into how you would like people to be treated in your organization. It'd be good to share that information with the group. But as you're thinking of some of those things, let's do some real quick post polling. So Patricia, if you want to pull up the first post poll. And this is just, again, how are you feeling now about your understanding of what it means to think of patients and families as customers? You can put your answer in there, and then Patricia, I'll give you another 5 to 10 seconds to fill that out. Thank you, Patricia. 90% confident, 7% somewhat confident, and 3% neutral. And next question, thank you. And then how are you feeling about your understanding of techniques that improve patient and provider communications? Again, it's confident down to unconfident. You'll have another 5 or 10 seconds to fill this one out. Thank you, Patricia. 74% confident and 26% somewhat confident. And then our third and final post-polling question. And you are confident down to unconfident that you will apply knowledge gained from today's training to improve the patient experience at your organization. Thank you at 82% confident and 18% somewhat confident. Thank you so much for your feedback, everybody. And next slide, Patricia. And I haven't seen any questions or comments coming in through the chat box. We have a pretty quiet group today. So if you want to go to the next slide. Just a reminder again, next week is the third and final webinar in this series. And that again is Thursday at this same time, so April 22nd. And then we have the value-based care series coming up starting May 6th and going through June 3rd. And you can find more information on all of those upcoming webinars on our website, and it's located right there at the bottom. And next slide. And we just want to thank you all for joining us today. We look forward to seeing everybody again next week. Oh, and we did get a question from Patty. Hi, Patty. What was the name of the Michael Solomon book that was referenced?
Michael Solomon book. Micah Solomon, it's M-I-C-A-H, Solomon, and it was a Journal of Patient Experience. It was an article. I can, and that link should be in here, but Kate, I'll go back and check on that. And if not, we'll make sure it's sent with these slides.
Okay, that sounds good.
Okay.
Yeah, I was just gonna flip through too. Yeah, thanks for the question, Patty.
Mm-hmm.
Okay, with that, thank you all so much for joining us today, and we will see you again next Thursday. And Carla, thank you again so much for the wonderful presentation.
Yep, thank you. Thank you, guys. Let me know if you need anything.
Okay, thank you. Bye.
Thank you.